Hey guys, welcome back to my channel. My name is Jordyn and today we're going to be looking at my treatment. So I use Cinryze, which is a prophylactic treatment, an at-home IV for people who have hereditary angioedema. A prophylactic treatment means that the medicine comes from a blood product or a plasma product. And a quick overview of what hereditary angioedema is. It is a rare disease that causes uncontrollable swelling in various parts of the body, such as the hands, the feet, the intestines, the genitals, the face, the tongue, and the throat. Symptoms are obviously extreme swelling that won't go down. In the intestines, it would be uncontrollable vomiting, constipation, and cramping. And when it is in the throat, it would be a very sore throat, inability to swallow, inability to speak, and a very coarse voice. Cinryze is a blood product that replaces the protein that someone with hereditary angioedema is missing, because the protein that we are missing stops inflammation. Because we have nothing to stop inflammation, when we get an attack or start swelling, it just gets bigger and bigger with no ability to stop. There are 3 types of hereditary angioedema. There's type 1, type 2, type 3, and acquired angioedema. My sister and I have type 1 hereditary angioedema, but she will have her own video where she explains her story to you. She was diagnosed a month after me. In my opinion, Cinryze is very beneficial for someone who has hereditary angioedema. I have had one attack in 6 months, whereas I was going from one attack every 2 weeks. I've only had one attack, and it was because I was in a dance performance, which I kind of caused the attack to go off by myself. Other than that, I think that it has been saving my life. It has been making me feel 100 times better. Cinryze is the 5th most expensive drug in Canada, estimated on Forbes to be about $300,000 a year. And in my voiceover, you will hear me say that one of the vials is water. It's not water, it's actually like saline solution, but I just said water in the voiceover for time's sake, so just ignore me when I say that. Okay, now let's look at my treatment.
To start off with my treatment, you have to start off with the right setup. You're going to start off with 2 plastic transfer devices, a needle, a syringe, and an alcohol swab, and 4 vials. 2 of these vials are going to have water in it, and 2 of these vials have the C1 inhibitor inside. You're going to start by wiping all of them off with alcohol wipes. And then you take the transfer device and you place it right on top of the water straight down. And you're going to do that on both sets of water. And then you're going to take the Cinryze and you're going to just press the water down into that vial so that the 2 can mix. As you can see, it basically looks like water with a bunch of foam on top. There should be nothing floating inside of it. My mom's going to mix it together real quick so that everything has combined really nicely and that there's no powder loose inside. So now you take your syringe and you're going to unscrew the empty water vials from on top of the Cinryze. You're going to pull back 5 milliliters of air and screw it onto the Cinryze vial. You're going to push that air into the vial upside down, and then you're going to pull it back 5 milliliters so all the contents of the vial are out. You're going to unscrew it and then do the exact same thing again. Pull back 5 milliliters of air, unscrew the top of the water vial, place the Cinryze upside down, push the air in, and then pull back all the contents so you have 10 milliliters of liquid. It should look clear with no particles floating inside of it. My mom usually gets the bubbles out of the syringe. You want to get the bubbles out of the syringe so that there's no bubbles in your IV tubing. With a tubing this small, it's not really an issue, but you don't want to be pushing air bubbles into your bloodstream. So my mom likes to take the precautions. So next you take out your needle, you screw it on top of the syringe, and then you're going to prime the needle. So you want to follow the medication till it hits the needle so that you don't lose any medication, but the entire IV tubing is primed so that you're not pumping an empty air tube into someone's vein. So now we're going to actually start with preparing for the IV. You're going to start off with a mat, a tourniquet, some gauze, tape, and alcohol pads. You're going to sit on the couch, prop the pillow up in front of you, put the mat on top of it, and place the tourniquet on. You're going to clean the area with alcohol swabs. Clean it with 2 if you want the vein to pop out more, if your veins don't show very well. Then you're going to go in with the needle inside the vein. She's going to put the tape on top. To know that you're in the vein, you're going to pull back on the syringe, and if blood comes into the tubing, that means you were definitely in the vein. I'm going to pump 1 milliliter of medication in, and then I have to sit and wait for 1 minute. So after every milliliter of medication comes in, you have to time for 1 minute and wait, because the medication is supposed to be administered over a period of 10 minutes. So this takes quite a long time. And then 10 minutes later, my mom will come and take the IV out. She'll remove the tape and remove the needle. I'll already have an gauze and tape pad prepared, so I'll press that on. And you want to leave that there for 2 minutes to prevent any bruising.
That's my treatment. Thanks for watching, and I'll see you in my next video.